Alright, so my presentation is on the benefits of diaphragmatic breathing and guided relaxation in relation to the PTs in the clinic. Here's a list of the objectives, which you can read at your leisure after you've been relaxed and know how to breathe. Alright, so history of diaphragmatic breathing. It's been called a lot of names over the years. It's been called yogic breathing, belly breathing, three-part breathing, a lot of different names. The list goes on. As far as discovery of it, as far as I could find in my research, humans have actually always needed to breathe, and I couldn't find who discovered that. But it has been a pretty commonly known fact that we do need to breathe. Diaphragmatic breathing specifically has been around for thousands of years. It's been incorporated in a lot of Eastern practices like yoga, Tai Chi, Buddhism. Well over 5,000 years of use in a lot of those practices. More recently, in the modern breathwork techniques that we've been seeing developed, specifically starting in the 60s and 70s, right around the age where everyone was finding themselves and experimenting with a lot of new techniques and other things. A lot of modern breathwork techniques were developed then. Basically, I'm just looking at the basics here with diaphragmatic breathing. I'm not looking at all the other reasons for diaphragmatic breathing. I'm not looking at the spiritual side. I'm not looking at the meditative or achieving like wholeness or centering yourself. Breathing has been used for all those things, but for this presentation we're just specifically looking at the medical uses and effects of breathing, and specifically diaphragmatic breathing. So when are we going to want to use this? Usually pretty good everyone should be using it, and as PTs we can and should encourage focus on breath in our exercises and just day-to-day living. Usually people aren't breathing correctly. They're usually breathing shallowly, and a lot of that has to do with just our culture and our standards for what we consider attractive. I know personally I've fallen prey to that, especially in high school. I was a lot more concerned with what people thought of my appearance, so I tended to kind of suck my belly in, and that when you're doing that, when you're sucking your belly in like that, trying to keep that flat stomach that everyone wants, and that's the society's definition of desirable, then what you're doing there is you're cutting out a lot of your a lot of the room that your diaphragm has to move, and then so consequently you're cutting out a lot of the room that your chest has to expand, and you're decreasing the amount of oxygen that your lungs can expand and the amount of oxygen that they can take in. So all that to say, some indications are going to be some tension-related diagnoses. You're going to see that a lot in this next one with people with stress and anxiety. They're often times going to have a lot of tension-related diagnoses as well. You might see these in patients who are using their accessory muscles to breathe. If you're seeing a lot of that, that chest breathing, not really that belly breathing, then that's going to be a good indication. People that are experiencing pain, diaphragmatic breathing has been shown to decrease pain and just help with pain management in general. Improving respiratory capacity. A lot of studies have shown that it does increase tidal volume and oxygenation in patients. There are some conflicting studies out there, which we'll get to in a little bit, so we do need to be careful with that. But it would be a good idea to use for people who need core stabilization. Diaphragmatic breathing is naturally focusing on the diaphragm and the abdominals, incorporating those in your breath, so that kind of feeds into core stabilization there, and it'd be really easy to pair those two together, some core work and the breathing. And lastly, people with difficulties breathing, diaphragmatic breathing is going to help them with that, so you're going to re-educate them on their breathing techniques. Benefits of diaphragmatic breathing, a lot of benefits. So could improve the exercise capacity and respiratory function in patients. Has been shown to possibly, for patients who have been using diaphragmatic breathing correctly and for an extended period of time, it's been shown to increase their exercise capacity there. Diaphragmatic breathing encourages relaxation because it decreases your respiratory rate and consequently your heart rate and blood pressure. I kind of mentioned this already, but it improves your core stability. And then lastly, it improves your exercise or your tolerance to intense exercise. So how do we perform diaphragmatic breathing? You can do it lying down, sitting down, standing up. If you're instructing a patient that's brand new to it, it would be preferable to do it lying down. That's when the patient's going to be the most relaxed and be able to perform it correctly. And then in addition to that, a lot of the patients who are dealing with some stress or anxiety, and you're doing this to help calm them, relax them, laying down is going to be better anyway because it's going to promote relaxation. So when we're doing this, we're going to go ahead and place one hand on your chest. You're going to place one hand on your belly or over your diaphragm, and then you're just going to notice your hands. You're going to notice which one's moving more. So whichever one's moving more is the one that you're predominantly using to breathe. So if the hand on your chest is moving more, that means you're breathing shallowly. And you're using a lot more accessory muscles to breathe. You're not using your diaphragm to its full extent. If the hand on your belly is moving more, then that means you're at least breathing more correctly. You're using more of your diaphragm to breathe than your chest. So I know on the slide here it says the hand on your chest should remain in the same spot. We're humans, we're imperfect. So if the hand on your chest is moving a little bit, that's okay. What you really want to look for here is that the hand on your stomach is moving more than the hand on your chest. And then as far as the breath itself goes, you're going to instruct the patients to inhale through their nose. And then we're going to be exhaling using pursed lip technique. They don't strictly have to use that, but a lot of the studies have shown that diaphragmatic breathing and pursed lip exhalation combined has more beneficial results than strictly diaphragmatic breathing. So this brings us to the three-part breath. This is a technique that I usually use when I'm teaching yoga, just because I like how it was explained to me. It helped me understand it a lot more and focus on my breath a lot more. And so I like to use that when I'm teaching others about their breathing. So three-part breathing is your abdomen, your diaphragm, and your chest. So how you can explain that to your patients is you're going to start down in your belly. You're going to fill your belly. You're going to go ahead and expand your ribs. And lastly, you're going to fill your heart. So that 3-part breath is filling the belly, expanding the ribs, filling the heart. And then you're going to exhale. Exhaling, starting at the heart, releasing your ribs, and finally, with tight muscles, tight belly muscles, releasing the breath in your belly. So you want to be careful and cognizant of your patient as they're performing this. You want to make sure they're not forcibly exhaling, because this is just breathing. You just want them to do it right. So it should be smooth and even breaths, but if they're forcibly exhaling, then the patient could begin to gasp on their inhales because they're exhaling too much. And then that could lead to irregular and insufficient breathing patterns, or possibly even bronchospasm. And you'll also want to be aware of your patient if they're performing this diaphragmatic breathing incorrectly, like specifically if they're if they're doing a lot of excessive deep breathing, then they could begin to hyperventilate. And then you also want to be aware of your patients, because this could cause some dyspnea for certain patients, especially if they have like COPD or a pulmonary diagnosis. So really you want to, everyone needs to be breathing correctly, and it would be beneficial to everyone, but you really want to be aware of your patient and do this on an individual basis, because it could cause some detrimental effects, or at least cause some problems for your patients. And then as far as the how often this should be performed, if the patient's starting out, they should be practicing roughly 5 to 10 minutes, 3 to 4 times a day. If they're just starting out, and then as they get more experience with it, you can increase the duration and you can increase the frequency. So diaphragmatic breathing in research, there's a lot of it out there. It does appear to have a favorable effect on the cardiovascular system in the brain. And you see that in the relaxation, decreased amounts of stress, anxiety. There's a lot of benefits to it. It has been shown to increase tidal volume, like I mentioned earlier, and oxygenation in patients with COPD, without increasing dyspnea, which is important because a lot of the conflicting research out there is, a lot of the main points is saying that diaphragmatic breathing is causing dyspnea in these patients. So the fact that we can increase the patient's oxygenation without increasing dyspnea is a really good sign and a pretty good indicator that this should be performed, or at least attempted, and then basing the continuation off of the patient's response. It has also been shown to reduce oxidative stress from intense exercise, and possibly even improving exercise performance, which I mentioned earlier as well. And that goes back to implementing this in every aspect. This does have really good effects and indications for people with stress and patients that you want to create some relaxation for, but we should be introducing it throughout our exercises and everything, because breath is important. We need to be connecting the movement to the breath. In addition to that, it's going to help avoid patients performing like the Valsalva maneuver. So you're really killing 2 birds with 1 stone if you're instructing all of your patients, regardless of if they're coming for relaxation or not. If we're instructing all of them in their breathing patterns, then you're going to be preventing a lot of issues down the road. So at this point, we're going to go ahead and practice that. So I'm going to have everyone either find a comfortable position. They can either sit down, lay down. They could stand up, but I'd prefer sitting or laying down so that they can experience what a first-time patient's going to be feeling. And they're just going to go ahead and evaluate our own breathing. So placing that hand over your chest, one over your stomach, we're just going to focus on your own breathing, seeing are you breathing shallowly? Are you performing diaphragmatic breathing? And at that point, I also want to compare the instructions that I had gone over earlier. I'll be giving everyone a handout at this point with the visual instructions for diaphragmatic breathing and three-part breathing. And then I want everyone just to compare, if you're just using your hands to measure that breathing, what that feels like versus that three-part breath. So go ahead and fill your belly. Inhale, fill your belly. Expand your ribs. Fill the heart. And exhale. Empty your heart. Relax your ribs. And with those tight belly muscles, release the last of your breath in your belly. So then at that point, we can go ahead and discuss with everyone just the differences we felt there, how much of a fuller breath and more air you're able to get with that three-part breath rather than just focusing on which hand's moving more. And I mentioned earlier, this is really good for relaxation, so it pairs really, really well with guided relaxation, which is another practice I use in yoga a lot. I like to end all my yoga sessions with this. And this is going to be really helpful for patients who are suffering from anxiety and stress, and it's even been shown to help with pain and sleep disturbances. So with guided relaxation, same with diaphragmatic breathing, there's a lot of relaxation techniques out there. Some people use meditation, some use guided visualization, all this other stuff. I'm just want to talk about how we can just use this real easily in the clinic. So we know that it's been shown to lead to less dyspnea, decreased pain, better sleep. So how can we utilize this ourselves? This is going to be a little more individualized. So we are going to want more of a quiet environment for this. We're going to want to let the patient be in an environment where they feel safe and comfortable and relaxed, since that is what we're trying to encourage here. Some people use music or like peaceful sounds, nature sounds. I don't really use any auditory aids when I'm doing it. I'd prefer just to focus on the breath. But auditory aids can be helpful. They can be nice. It's really just your personal preference. And that's again why practicing is so important, because you can find how you feel, like for example, peaceful music affects you, and if you think it really helps, then you can use that for your patients, and if not, then just focus on the breathing. The other key here is to get the patient in a position they feel relaxed in, so preferably laying down. Like I said, with the guided or with the diaphragmatic breathing, laying down is the best position. It's going to encourage relaxation the most, but some patients they have stuff in their history where they just don't feel comfortable laying down, with you in the room, or they might not feel comfortable closing their eyes. So really just whatever position the patient can get comfortable in is what you want. And then another note I wanted to bring up here, after you've gone through it with the patient and you've identified that they're safe to do this diaphragmatic breathing and this guided relaxation, then you can encourage the use of smart watches or trackers. Most of them have it. I know like Fitbits have a guided breathing tool. I know Apple Watches have it. So most smartwatches out there and wearable technology out there has it. And if not, there's plenty of cheap, affordable ones that they could get to help them practice it at home, because it takes away the responsibility of taking themselves through it. They can just follow that buzzing on their wrist for their breathing, and they can just focus on the breath and the relaxation. So at this point, we're going to go ahead and I'm going to take everyone through a guided relaxation. So we're going to find a comfortable position, again, either sitting or lying down, preferably laying down, but I understand if that's not comfortable for everyone, especially in this presentation. And then as I'm taking everyone through this guided relaxation, I want everyone to focus on their diaphragmatic breathing while we're doing it. And we can really get the benefit of both of these techniques here. So usually the guided relaxation goes something like this. You're going to want to find just a spot on your body that just feels completely relaxed. That could be your knee, your calf, maybe your right big toe. Just find a body part that just feels completely relaxed and focus on that feeling. You want to focus on the relaxed feeling. Right? And then what you want is you want to shoot for that throughout your whole body. So you're going to inhale, thinking about that relaxed feeling. And as you exhale, you're going to just envision that relaxation radiating through your foot, down your leg. You want to envision your heel sinking into the ground, feel your calf relaxing. Let your knee just sink down into the ground. And then on your inhale, you're going to just think about that relaxation, how much it's spread. And on the exhale, you're going to envision that relaxation spreading up your legs. And then we're going to go through that. Basically, you take them through the entire body. You progressively relax each part until you're just completely relaxed. And at that point, you can just focus on your breathing and just relax. You can do that for 5 minutes. You can do it for 20. Whatever you deem is appropriate as the clinician, or whatever the patient is comfortable with. And like I said, those smartwatches and wearable tech usually have a adjustable time frame, so the patients can perform that at home for 5 to 10 minutes or longer if they want to. And at that point, they've got their hand out, so I'm going to have to wake everyone up after they're all relaxed and comfortable, and we're going to have to get back to work.